Hello, King's A&E. In 10. Thank you. Bye. 10.
King's College Hospital, London. A major trauma centre.
Have you got her blood pressure yet?
She was on the floor and I thought she's dead.
And one of the busiest A&E departments in the world.
Stabbing, code red.
King's is everything. Everything pows in through that door.
The badge has been trapped between him and the bridge.
A place where love.
Can I wait here until she comes home? Can I come home with her?
Life.
Oh, apart from having a brain injury, never better.
What happened?
I got bitten.
By who?
By me mate.
And loss unfold every single day.
I've not got a happy feeling of you. No. Not breathing. Stop breathing.
All the patients you're about to see were treated in one department, in just one 24-hour period.
It's going to be all right. You know what happens when things are bad? Daddy's here.
Please don't cry.
The moment that you're in resus and you're really sick and all you can think about is, am I going to live? Am I going to die? Silly things go out the window. And ultimately what's important is realised that you're loved and that you're not alone.
I'm still at the hospital. I'm still in King's College Hospital. My finger, I dislocated my finger. Hello?
Whitney Houston's dead.
Oh.
Shame, innit?
Yep.
48 she is. She was a bit mucked up, wasn't she?
Oh, the night that Whitney died. Yeah, it was a bit of a shock, really. It all just went round the whole department and everybody was very upset.
I can't believe Whitney Houston's dead. I just think that's so shocking. And that's my dad's age. It's really young to be dying. Because it was the same thing that happened with Amy Winehouse, wasn't it? Star burnt out by drugs.
We know our own mortality and everybody else's, you know, but anybody who dies quite young in that kind of circumstance is kind of sad. And I think everybody's got a bit of an affinity with Whitney, haven't they? They've all sung to one of her songs.
See? Fame's not all it's cracked up to be.
It's not. Not at all.
Do you want anything? Do you want a drink or anything? My jaw hurts so much. But just thank God there was no cars. Just seeing, literally, I stood up and it was just pouring onto the pavement and I was just bleeding all over the cafe front and I was like... I get to go and sit in my trade meeting tomorrow morning. Looking like an absolute tool.
You know that one now, that sexy band.
Tell me when you feel ready.
Sunday evenings tends to be a little bit busier for us, because in minors, you know, you get a lot of people walking through the door that have sports injuries.
Don't move it, don't move it, don't move it. Keep it still.
You do get the people that are a little bit drunk and have fallen over and injured themselves a little bit, people with cuts and stuff like that. But next door in resus, they might have, you know, a lot of trauma cases or really sick patients that, you know, we're doing everything we can to ensure that they don't die at the end of the day.
A&E resus.
All right, Dan. I'm Amanda, all right? I'm just one of the technicians. We've got a lot going on here, girl. It's like Spaghetti Junction. That's better.
Thank you.
It's 21-year-old Danielle's first time in London. She's here for a girls' weekend with school friend Leanne. She flew over despite feeling unwell after an exercise class back home in Northern Ireland.
You scratched my nose.
Where? We're more like sisters and best friends, to be honest. We talk every day, 2 or 3 times a day.
Hands,
right okay?
phone, 10 minutes, hands, right phone, 10 minutes.
Scratch your nose. At home we were together 24/7, and it's been kind of weird since I've moved over here. Don't see each other as much.
Leanne and flatmate Pella are both newly qualified nurses at King's.
Danielle was arriving on the Saturday morning, and I was so excited. Like, we were going to go to Oxford Street, we were going to go see a West End show, and then we were all going out together on Saturday night. No, Sabine, you have to see the videos that they took of me. It's unbelievable. I know, I'm actually so ill. Like, I was up being sick this morning. It was like me and Danielle taking alternative times of boking. You actually have to see the videos.
Look at that.
I was eating, and like I started boking, like in the toilet, because they told me there was a hair on my toast.
Oh my God.
Look.
Oh my God. What way is that going down the corridor?
It's so bad, like, unbelievable. But wait, you hear this here, Sabine? Wait, you hear this? Danielle couldn't even go out last night. We had to like leave her in home. Just like her legs just gave way when she walked out the door. She just collapsed. No, like her legs are like actually the heaviest things, and they're so swollen. It's unbelievable. Her legs are like legs. She can't stand. Sunday morning I got up. To be honest, I had a bit of a sore head myself, and her legs were really swollen.
Oh my God.
Sore?
Yeah.
She was sitting in the bed, and it was like she was there, but she wasn't. As if there was somebody else behind her eyes. It was just weird. I said, no, right, we're going to take you to hospital. She didn't really want to go, to be honest. Then I rang a taxi, and we literally had to carry her out to the taxi. You okay?
Yeah.
Oh, Danielle. You came over for one weekend, first weekend, and this is what happened to you. Your mum's never going to let you come back again.
Hi, I'm calling from A&E, one of the registrars here. I've got a young girl who's come in with history of being unwell, vomiting for the last couple of days, and both her thighs were quite firm feeling and very tender. I'm treating her for hyperkalemia, and I've given her some fluids as well. She probably has got some underlying muscular dystrophy or whatever, which we haven't identified as yet. But because of her renal failure is why I'm talking to you.
The ticking time bomb cases are the ones we are always wary of, constantly observing them, constantly checking them on, which is why we are always cautious, because this patient has come into us today in A&E purely because there's something wrong. I suppose emergency medicine is a specialty where we really do have to expect the unexpected.
Danielle, I've just referred you. You're going to be, like I said, you're going to be admitted. Now, basically, I know since yesterday you've had the pain in your legs. I don't know the bottom line cause for that. But the breakdown of the muscle is what is bringing your potassium up and putting your kidneys under strain. We'll need you to wee, because until we wee, you won't wash it all away, so you'll be weeing a lot. We'll give you lots of fluids to wash out all the toxins away. Okay?
Yes.
Yeah?
Yep.
Good luck then.
Thank you.
All right.
Thank you.
No problem. Thank you.
Yeah. She's definitely in the best place to get us started, like. Do you know what I mean?
This is a transplant centre too.
Oh my God, don't tell her that. You don't need a transplant, Danielle. Shut up, babe. It's not funny. Kelly, go. Ow.
Take a seat. I'm Nancy, I'm one of the nurse practitioners. So what happened?
Took a corner too quickly on my bike. I didn't even have a chance to put my hands on the floor.
No. Oh, that's going to need stitching. Any pain in a press?
No.
No. How delightful is that? What I'll do is I'm going to take you through to another room where I can lay you down and put some stitches in there.
We'll always love you. Oh, poor old Whitney.
Whitney Houston has died.
I know.
One moment in time.
I love Whitney Houston. And you see, I tell you, these men, every woman downfall is linked to a man. Blonkers.
Okay, so we've got 1, 2, 3, 4, 5, 6, 7 stitches. Okay, and they need to be removed in 5 days' time at the GP surgery.
Could you hear me?
What?
Fuck. You need something really sugary. Or like a chocolate bar. I've got. Do you want me to go and see if I can find something? They should have like a cafe place.
No, it's fine. I'm just cold. I just need to get home and get warm.
Whitney Houston, honestly, it's such a tragic end. Whitney Houston, she's dead.
A&E resource King's College Hospital.
2 hours into the Sunday night shift, and the 10-bay resus room is almost full.
Can we assess his chest, please? Just hold off a little bit there. Can we just assess his chest? Let's just have a look. Let's start with breathing. Thank you.
Danielle's kidneys are being closely monitored.
Yeah, blood gas is 7.2. She can't wee, so...
Otherwise, no medical problems?
No, no medical problems at all. The only time she's been in hospital is when she had her tonsils out.
Okay.
Let's wait and see.
Okay.
Yeah, just keep an eye on her.
Yo, Daddy, I'm still in like resus, so... Yeah, because I haven't passed any urine since yesterday and they just want to monitor my kidneys. You know, they're measuring my urine's okay and...
What you're putting out is the same as you're putting in?
Aye, what I'm putting out is the same as I'm putting in.
Because it's muscle breakdown?
Because of the muscle breakdown, that's what it's
It's
done.
released toxins?
It's released toxins that's...
The kidneys are finding it hard to pass?
Because the kidneys are finding it hard to...
Pass these toxins?
Pass the toxins from the muscles.
So this will help you get them out of your system?
I had went to an exercise class the day before, my first ever spinning class. There's about 20 bikes in the one room and the instructor's, he's telling you what to do and you have to go with the beat of the music, so it's really fast cycling. It's quite hard to do, but I thought I could do it because I've been going to the gym 3 times a week, so I wasn't really just bouncing in and doing a spinning class. I thought I was fit. I feel absolutely horrible. Like, I'm not even worried about my kidneys, like my legs. I'm in absolute agony, like the movement in them is getting less and less now. I fell off the bike when the class was finished. It was throbbing pain, but I just thought it was sore muscles.
She went to a spinning lesson on Friday and since then had suffered this bilateral leg pains. And I just think she's basically got rhabdomyolysis.
Rhabdomyolysis, in simple terms, is just muscle breakdown. We see that quite common in A&E because we see a lot of patients who come in with crush injury. But it's quite rare for patients to actually develop rhabdomyolysis just with one session of exercise.
A&E, King's College Hospital, resource department. Thank you, bye. Adult red phone, ETA 4 minutes. Adult red phone, ETA 4 minutes.
Paramedics are bringing in a patient whose heart has stopped.
Yeah, come.
Oh God, look at this.
Most patients who have a cardiac arrest away from hospital don't survive.
Got an ECG and I just...
You're taking that one, Matt? Are you comfortable with it?
Yeah. Let's get him across and then connect him to our life bag.
Still changing.
It's all kicking off in here now. I'm a newly qualified nurse, not that long. I've never worked in A&E, I've never had no experience, and all I know is resus is not good.
Guys, the gas is back. He's got a pH of 7.06 with a lactate of 9. His bicarb is 8 with base excess of -20. So it's...
Every cubicle's got something different in, with somebody going through another trauma, someone who's, got something that's going to change their world forever. Unfortunately, with curtains, you can still hear everything over the top and under the bottom and everything else. So I think if you were sat in one cubicle and you could hear everything else from the cubicle either side of you, it must be absolutely terrifying.
OK. Can we do a pulse check? Do we have a pulse? The time is now.
Yeah, I got a pulse.
You've got a pulse?
So do I.
OK. Great, let's go back to the beginning then. Airway. Well done, guys. Thank you very much. LMA. Thank you very much. Hello, King's College Hospital. No, it's the trauma consultant, actually. You're just breaking up a little. Fall from height. OK. That's brilliant. Thank you. Bye.
What is it? I'm ringing LAS.
It's fall from height, 16 with a head injury.
Head and limb injuries.
Hems, red phone, 10 minutes. Hems, red phone, 10 minutes.
HEMS, the helicopter emergency medical service, can treat serious trauma patients at the scene of the accident. They spent 30 minutes stabilising this patient before bringing him in.
Rachel, just bear with me 1 second, sorry. Just let me answer this really quickly.
So I've got a 16-year-old fall from height who's coming into here.
Hi, how are you? It's Maria, site manager. Now, I have a lady in resus. She hasn't peed in a day. She's only 21. I spoke to renal. They've no beds, but they were waiting for an elective to come in. No, ring him and ask him to come in the morning because I can put her into the renal bed because it's full in resus with 10.
This is our HEMS call.
Oh, Jesus.
Guys.
Wait, yeah,
I've just literally got a HEMS patient going by me now at the moment. I've got one ITU bed. You know, the place is in a critical state.
It's all right. We're kind of ready.
A schoolboy has fallen 20 feet from a second-floor balcony.
Oh my God, did you see that? Oh my God. Go.
This is Aaron. He's 16 years old. He's had an unwitnessed fall approximately 20 feet onto concrete. His GCS on our arrival and on the arrival of LAS was 15. Injuries from top to toe. He has a frontal head injury and is developing bilateral periorbital hematomas around both eyes. He's got bilateral wrist fractures. He has improvised splinting to both wrist fractures. He's had no volume issues and has been stable in transfer. He's had a total of 7 milligrams of morphine to good effect. I believe his mother is coming separately. She wasn't on scene, but she's been informed that she's coming separately.
Great.
Aaron, can you remember what happened?
Hello, Aaron. I'm Simon, and I was one of the doctors here. Just gonna check your breathing.
Right. He's got an obvious injury to his forehead. His pupils like. He's had 7.5 of morphine, hasn't he?
Second floor balcony. I think he's fractured both his wrists.
You can fall over from standing and die. You can fall quite a height and survive.
Aaron, can you take a big breath in and hold it for us? Big breath in. Aaron, take a big breath in.
Aaron, big breath in. Big deep breath for us.
16-year-old, 20 foot, first thing you think is 20 foot, that is a long way. That is a long way. You're a lucky person if you just walk away with fairly minor injuries at the end of that.
Has got equal air entry, but quite rapid, shallow breathing.
It's rapid and shallow.
Any pain in your tummy? Aaron, have you got any pain in your tummy? Talk to me.
Whereabouts?
Where she's touching, does it hurt?
You saw it where he fell from.
Yeah, well,
It was a high second story,
it
actually.
was.
And any family giving any clues? I mean,
His family weren't there. He was with a mate. He was out on the balcony for some reason, and they were messing about.
Just
and he
launched
just he's
himself.
fallen.
Yes, both arms.
There's carelessness in every age range, but I think when you're younger, you don't understand, you know, if you go and do this, this is what's going to happen. You just think, sod it. I can honestly say, when I was younger, you know, I drive my car like a maniac, I'll take risks, you know, and you do. You think that you're immortal. You will always be here.
Thanks, guys. See you.
So what's the plan?
Right. I think he definitely warrants a CT head.
I need to go to the toilet quickly.
The toilet's here, look.
That's the disabled toilet.
That's all right.
No, you have to ask first.
Go on, go in. Hurry up.
No,
Quick, go on.
No, I don't want to. Don't worry, I can hold it. What languages do you know how to speak?
None. I was taught French, but didn't understand it.
Bonjour, comment ça va? Ça va très bien, merci, et toi?
Well, there you go. You can speak a bit of French,
1,
can't
2,
you?
3, 4, 5, 6, 7, 8,
Yeah, well, everyone can do that. Well, it's good to have a language, because when you get older, you can get jobs translating.
Oh, I want to learn Spanish now. I want to be Spanish.
Pick your coat off the floor. Who got you that hat?
Huh? I brought it today.
Did you? Where?
From the little pan thing done Peckham.
Forward to X-ray, please. Forward to X-ray, thank you.
There must be some problem with her muscle.
There must be something underlying, and it's just
Must be.
exacerbated it.
Maybe she's got a bit of kidney failure anyway. Do you know what I mean? It's just tipped him over here.
Guys, can we have some help in here, please?
It's arrested again. Oh my God, again.
What I can still remember from it is the constant beeping of the monitors. I just don't even know what way to describe that environment. It's somewhere I never want to be again, to be honest. Never.
Okay, stop. Do you want to do a pulse check?
Who died? Somebody's dead. Somebody's died.
Could I have a quarter to recess, please? Quarter to recess.
I couldn't work in here, I couldn't. No way.
It's a bit of a sad day today, isn't it?
I don't know whether she's coming or going. Do you like being a nurse?
Oh, yeah. Couldn't do it if you didn't like it. So what do you want to do when you grow up?
Be a nurse.
You want to be a nurse? Excellent. That's good.
I don't want to deal with too serious injuries. I'd be scared.
Oh, it's always scary when you first start because you don't know anything, but once you've been taught and you learn and you get experience, then it's not scary.
Yeah.
"16-year-old Aaron is in resus. He fell 20 feet from a second-floor balcony. He needs a full body scan. Only then will the full extent of his injuries be known.
Mum, come round this way. Aaron, open your eyes. Is Mum here?
It'd be quite scary to see your son like that, wouldn't it? Oh, bless her.
He's got some injuries on his head and his wrists and in his tummy, but we don't know exactly what until they've told us, okay?
I was just going to my bed. I had a phone call. The lady said to me, Aaron have an accident. Because Aaron ride a bike, I thought he fell off his bike. And she said to me, it's not the bike. He fell from the second floor down. I drove to the hospital. I didn't know what to expect. I didn't know how bad he was hurt until when I saw him. His face was there, but he looked different. He was helpless. He can't move. Aaron? The only thing I could do was hold his hand. I was trying to talk to him, but he wasn't responding.
He's opening his eyes.
Aaron, your mum's here. Hello, excuse me, he's been sick.
Okay. Come in.
Jesus.
You got any more in your mouth? Yeah?
Right, mate.
Okay,
Sorry,
come in.
darling.
All right, well done. Sorry.
Jeff, yeah, he keeps vomiting a lot. I don't know what you've given him.
What have we given already?
When parents are in that situation, it's heartbreaking, it's awful, you know. I've got kids myself, and since I've had a family, I've more often put myself in their shoes, and, you know, if you've got something awful happening, then you've got to realise that you haven't only got the patient to look after, you've also got the parent to give support, and, you know, that's important too.
Because he's banged his head, it can make you sick, but also they gave him some morphine for a painkiller, and that can make you very sick. We can't move him because his neck's, we still don't know if his neck's okay or not till we've done the scan, so we can't, I know it's horrible to see that. So we'll clean him all up.
What do you think about old Whitney Houston?
Yeah, I liked her. Silly, aren't they? They get on the old drugs and that's it.
Oh, Whitney.
Oh, come on.
No, in the olden days, she was beautiful. She was
amazing. How did she die, do you know?
Don't know yet.
I love Whitney.
Everybody love Whitney, man. She had best. It's just like how you see Michael Jackson in a male version, and Whitney in a female version.
LaToya. Right, through this way. Right, we're just going into this bay here, LaToya.
34-year-old LaToya has fallen during a night out with friends.
Right, nice to meet you. I'm Josh. I'm one of the doctors here.
Oh, you was my ex-boyfriend. You got my ex-boyfriend name.
So what happened this evening then?
Oh, I was at a party and my shoes give way and I fell and knocked my face.
You fell, did you? So,
And you bang the front of your head here?
Very nasty bang.
Yeah. Do you know if you lost consciousness?
No, never.
No, you got yourself straight back up.
Yeah.
But you got obviously a bit of a cut going on under there.
Very nasty cut.
Yeah. So you're feeling all right?
I'm all right. Just need a nice stitches.
Right, let's have a little look at this head then, shall we?
Yes.
So what did you bang it on?
On the floor. Is it that bad?
Well, you've done quite well here. It's pretty deep.
Jesus, guys. It got to be stitched or...
That's definitely got to be stitched, that, yeah.
God. What a bang.
Right, just follow my finger for me. Up here. And follow it over here. That's great. Right, we're just going to have a little look in your eyes. Anybody got a pen torch at all? Who's well prepared and has a pen torch that I can borrow very quickly? Oh, moment of truth. Fantastic.
Yeah, I think that's very sensible. Let's do that.
Right, just gonna have a little look in your eyes as well now. Just keep looking straight at me. Okay. Well, it looks like you've just done this laceration to your forehead here. It just needs to be stitched up.
My legs are killing me. My legs are killing me.
Let me see your legs now. I think you're definitely getting bigger.
They are. It's so bad. It's so sore. Movement in them is getting worse.
Danielle collapsed after a spinning class. The toxins released by muscle breakdown in her thighs may be causing kidney failure.
Your kidneys are your organs which actually filter out all the toxins away from your body. It's just not one organ which would be affected by a failing kidney. There's lots of organs which would be affected. You could be more confused. Your brain might be affected. Your liver might be affected. It could even lead to a cardiac arrest.
Why am I not feeling better? What? Why am I not feeling better?
Her legs were really swollen. Especially keep thinking back to this happened from doing exercise. Or like, how did it come to this? The ugliest book. What the fuck's that? She didn't realise how sick she was, but I did. I am a nurse and I know what these things mean. I knew how serious it was, and like, I didn't want to scare her by saying, like, seriously, like, she's not well.
Danielle isn't responding to treatment. She's going to a renal ward for specialist care.
Patrice, are you free to go to CT with this guy?
Both wrists are broken, so just be careful.
What was going through my mind, I was thinking about the worst scenario. He could break his neck, dropping from the second floor down. He could brain damage. It was the worst thing to think about.
Should them give him the morphine? Yeah, and vomit up 2 times.
We just took a HEMS call. Boy's come in, he's 16 years old. He's had a fall from 20 feet onto concrete, so quite a significant drop. He seems to have sort of rather shallow breathing, but not very good air entry bilaterally.
Aaron was born at King's. He weighed 8.5 pounds, so he was big. He was always a happy child and a bit mischievous as well. I brought him up by myself. Anywhere I'm going, he would want to come. He would rather to be there with me as a child growing up. I was his mom and his dad.
When will it ever stop?
I think those shoes are a danger, aren't they?
I think so as well. I'm going to get some compensation from that shop that I bought them from.
You're going to have to get flats from now on.
Nah. Oh, Whitney Houston let me drop tonight, you know that, Josh?
What's that?
Whitney Houston.
What about her?
They were just playing Bare Whitney Houston at the party.
Is that right?
And I'm one of her idols. I idolize her. So, just get a bit crazy.
So was it while you were dancing to Whitney that this happened?
Yeah, I had a slip at that Whitney tune.
Do you know what Whitney tune it was? You remember forever?
Yeah.
Which Whitney tune? You cut your head open till...
I will always love you.
That one.
Well, we might have already found Whitney's replacement there. You sound
I'm telling
just
you,
like
think Whitney's
they thought
song
she
as
was here.
well.
She's not dead. She's
Yeah,
here.
yeah. They say, oh, that's second Whitney. If you like me, they'll come on, go in.
Josh, are you a specialist?
I'm training at the moment.
Training specialist?
Training to be a specialist in emergency medicine.
It's not deep, but it's just wide, isn't it?
Yeah, it's pretty deep.
Is it? Josh?
Yeah.
Can you do this as neat and as fine as you can, please?
Of course, I always do it as neat as I can.
Okay.
All right, that's number one in. And already the edges are coming together nicely. It's a nice, clean laceration.
Fucking hell, I feel that one.
We need to get you that tetanus booster as well. All right, all done.
Oh, thank you, Josh.
I think that's your raspberry lip balm, not mine.
Oh, I'm weary. It's been a long week.
I'm exhausted now.
Do you want to come down into this chair, this seat here, and then we'll give you the jab?
Straps on LaToya's 8-inch heels gave way while she danced to Whitney hits at a party.
Right, what do I need? I need a nurse. I don't know where anything is. We're just looking for the jab that we can give you.
Make sure you find the right one. So I nurse there, Josh, I look fine now.
Yeah, shadow papa nurse. Yeah, I've just triaged her, yeah.
I tried to do it myself, but I failed horribly. I was looking for a tetanus
Oh, they're in the
jab
fridge?
for this lady. I even opened the fridge and I couldn't see them.
Nurse did more than that, Diana. I think the nurse deserve money.
This is what happens when I try and do things myself.
It's good. I'm liking the fact that you're trying to do it yourself. But you're failing miserably.
I know.
Hello there. I need to give you a tetanus injection. Sharp scratch. All done. That's fine. It's not bleeding, all right?
Thank you very much, Josh.
All right.
Thank you.
Take care.
Aaron's CT scan images are being carefully assessed.
He's gone down like that and whacked his face, hasn't he? So he's got you guys looking after his spleen, max fax, and then he's going to need some sort of neurosurgical input as well. Hey, Mum.
Yeah.
Hi, my name's Jeff Keep, one of the trauma doctors. Hello there. How you doing? Have you got any pain in your neck? Yeah? Okay, you keep your head nice and still. Have a feel of your neck. Good man. Okay. That's good. You turn your head for me, just to the side. Yeah? Any side you choose. There's no breaks in the neck, and there's no pain when I touch him. That's looking good. You lift your head off the bed for me. That's very good. Good man. He has some damage to his spleen, but we think it's stopped bleeding now. But we're going to need to keep a close eye on it. He's also got quite bad fractures to his face. His eye sockets are broken. He's probably going to need surgery on his face to fix the fractures. A little piece of bone has actually gone inside the brain. It doesn't appear to have done too much damage, so we're going to ask the neurosurgeons to have a look at that as well. He's very lucky. He fell from quite a height. Okay. Still more work to do. All right, good man. You're staying with us, all right? Not going anywhere.
You're lucky, but you'll be okay.
That's good.
Aaron was a lucky boy. And not to say lucky, God was on his side.
Jen, it's been a pleasure. Oh, there you are, Sue.
See you later.
It's been a pleasure.
Tonight, freak yourself out.
Thanks, darling.
He's just going to check the compartment pressure. Is that okay?
I literally pulled on my clothes and I went straight to the hospital, and she went to theatre. What I done was I sat in my work for 4 hours waiting for her to come out of recovery.
That's the anterior.
That's anterior compartment.
It was terrifying. It really was. I was so scared.
You can feel your ITB, just go just behind it. Yeah. Leave the needle in. Just leave that needle in.
I remember being on the balcony. When you're up there, it don't really look that high, but from what happened, it is high. You could hurt yourself.
I googled it when I came out of hospital. I googled what it was they said was wrong, and the word fail came up a couple of times. Alright, I'm just going to remove the staples. Yeah. I use it to get stuff at home. To my mum or dad, can you get me a drink? And they look at me, I go, I nearly died, can you please get me a drink? Which I probably shouldn't. My mum hates it, she gives me sort of a look when I say it, but at the same time, you have to laugh about it. You can't really lose your sense of humour.
Man that's been knocked over just outside.
He's got no pulse now.
He's a fighter, just hoping he'll get through this.
See, if I'd have been in the war, they'd have just chopped it off.
Do you like the elderly? And you say, is it too much? But no, it's okay, dear.
I've got good femoral pulse here at the moment. You do have to accept that we can't play God with people.